COVID fears are rising. Mask mandates are returning. Can you trust the U.S. Centers for Disease Control? We've recently published a paper on the many confusing and contradictory statistics on pneumonia, influenza, and COVID on the CDC website and their documentation. One of the most remarkable things is that the CDC actually has highly contradictory numbers of deaths due to pneumonia and influenza prior to COVID, March of 2020. The CDC FluView pneumonia influenza deaths are over 3 times the numbers used on the CDC excess deaths website and in their annual published leading causes of death report numbers. So CDC for many years has reported about 188,000 people die from pneumonia and influenza on their FluView website. However, their leading causes of death annual report reports only 55,000 per year dying from pneumonia and influenza. This is one of the most extreme examples of these contradictions. This plot here shows this dramatic difference, with the red representing the FluView numbers. For many years prior to COVID, FluView has evolved into a counter and website for pneumonia, influenza, and COVID, which is shown here. The green are the numbers from their excess deaths website data files, and also pretty much the same numbers used in the leading causes of death report. Again, they differ by a factor of over 3. There are many other confusing numbers and verbal claims on the CDC website and documentation. We have published a paper on this. You can get to it through this short bit.ly URL here or scan this QR code. I'll show the full URL shortly. Here is the paper. It's a review article, Recommendations for Improving the United States Centers for Disease Control, CDC Data Practices for Pneumonia, Influenza, and COVID-19, and was recently published in the International Journal of Clinical Skills. I'm not going to read the abstract, but we go into a lot of details on the remarkable discrepancies in the number of deaths attributed to pneumonia and influenza before COVID for many years, as well as many other remarkable, confusing numbers and sometimes contradictory numbers and claims, all of which are something which should be cleaned up and reformed by the CDC, both to establish greater credibility and to properly support busy medical professionals, health professionals, the average citizen. This is astonishingly confusing information to be presented to the general public if you actually look through it. And myself and I, collaborators, the authors, we go into a lot of this in great detail, explaining many of the problems. This is based on an up-to-date in November of 2021. What's the URL, the full URL? So here we have the URL, https://www.ijocS.org/clinical-journal/data-control-cdc-for-disease-control-data-for-pneumonia-influenza-for-data. Again, you can scan the QR code and you can use the short form URL here. Let me just spell that out as well. https://bit.ly/3RF capital Y capital O lowercase c number 6. 3RF capital Y capital O Z number 6. So with COVID fears rising, mask mandates returning, CDC and other agencies pushing COVID and influenza vaccines, shouldn't you take a hard look at those numbers that they're putting out and the quality of the information on their website?